Hi, I'm going to show you another technique you can use for nausea if you're travelling. It's really common when people go travelling on planes or boats or even in a vehicle. You might feel motion sickness. Any kind of nausea you can use this point for. It's commonly used in morning sickness kind of nausea as well. So the point is on your wrist here, and the best thing with acupressure to remember is that it's not about like a point on your hand, like as in just like press this dot. So I'll just put that little dot there. It's not just like press the dot and that's how it works. Acupressure is based on acupuncture, which is actually going deep into the point where the chi or the energy of that point is. So in order to get that sensation, then you have to press hard. You can't just sort of touch the skin. It's not just tapping the point or doing some weird thing like that. So the best thing that I can suggest you to do when you're traveling is use the back of a pen or a pencil, like not the sharp pointy end, the other side, and use that as a device to kind of press in on the point. Now with this point, with pericardium 6, the pressure should go down your hand. And what happens when you do acupuncture, a lot of time people open their hand up and they're like, oh, it really hurts, it hurts. Because you're pulling on the tendons directly where like there's two tendons here that point is in between. Now some people don't have that palmaris longus tendon that's just there, but flexor carpi radialis, that the main tendon that's there, you should have that tendon there, and you can just use that and just be like right next to that tendon. So don't press down on the tendon, push the pencil in between the tendons, and as that kind of goes, the sensation goes up the hand, you're pressing the point correctly. So if you're in the airplane, you can just use your hand, like your other thumb, to press on it. Other acupressure techniques include things like just pushing around, like going around in a little circle, or just holding onto it. So you should be able to feel a tingly, achy, heavy, numbness, something like that. So you can use that side, you can use the other side of your hand. It doesn't really matter which side you use, you can just use either side. If you press the point so hard that it kind of feels like it's getting bruised there, then use the other side, but try not to bruise your own hands. Like just press gentle out if you're bruising it. What you can do is you can press on that point, just hold that point there. So if you're feeling sick, you feel like you might vomit, you can press that point. On rare occasions, this point can make people actually vomit stuff out. Let's say you've eaten something poisonous and your body wants to expel that, well, then that's the best thing for you to do, so that it may make that happen. But if you just got nausea from motion sickness, then you shouldn't be eating anything poisonous. That won't be the reason. So it should subside the nausea. I'll show you how to find that point. It's pretty easy. All you need to do is have your other hand, so your two fingers of your other hand, and you use your wrist, and you basically just put your two fingers either side of the crease of your wrist. So the crease of your wrist, some people have like a few creases, like I have a few there, but just use the main crease, right? So this one here. So you feel between those two tendons. I've put a little dot where it is here, the point is. Now that channel, so the pericardium channel, is like right down the middle of your hand, so it's kind of like the middle here. This middle part, it changes when it gets up to here, but really what we're talking about is it's got to be right in the middle of the hand. So if you look at your wrist, and you want two fingers slightly spaced apart like that, and that's basically where that point is. Now the other thing with acupressure is we have these like measurements for the points. With acupressure, because you're not sticking a needle into your skin, it doesn't really matter if you don't get the exact spot, as long as it feels like the sensation's correct. So that means it's like if one little spot within this radius here feels more tingly or achy or heavy, then press that area. Okay. It's important with acupuncture that acupuncturists use the correct points in some instances because of blood vessels and nerves and things that are in that space. But with acupressure, like you can press on there, that's fine. So what you want to do is just palpate, which means just like press like that. Put some pressure around the area, feel which spot, like as you press deeper, which spot feels the most tingly. Okay, so that's how you find that pericardium 6 point. So two finger spaces, we call that like a sun measurement. So two thumbs basically from the crease of the wrist up towards you. The first technique that I showed you in the previous video, which was this massaging downwards way, I would try that first. If that doesn't work, then you can use this, or you could use a combination of those things. You could use a little bit of this massaging and then this point here. So that's your pericardium 6, really easy to use. Yeah, hopefully that helps you alleviate some nausea when you're traveling, or if you've got nosiness.